Welcome back, everybody, to Dr. Sellars Educate. We're happy that you're here with us as we focus on additional content area to get you ready for the CNE exam. If this is the first time that you are tuning in with us, welcome. And if you are returning for more than the first time, we're happy to have you back too. As you focus on closing the content areas, there is a critical step in the process that you must take to ensure you are ready. That requires you to go to the NLN website and to print out the candidate handbook. They have one that's unique for the CNE, the CNE novice, and the CNE CL. Okay, so make sure first step is to print out that candidate handbook. Now, for this specific snapshot, we're going to focus on 3 key components related to taking the next steps to get you ready for the exam. They are reflection, review, and readiness. These are all 3 key elements in our process that we help nurse educators get ready for the exam. If you have the resource in front of you, you want to go ahead and pull out Billings and Halstead Teaching and Nursing, the 6th edition. That is the resource we're going to use for this snapshot. So let's go ahead and take a look at the content that we have for us today. As we talk about the next steps that you're taking to close your knowledge gaps, we want to ensure that you stay focused as part of your journey to achieve success. It is a matter of time commitment as well as financial commitment to ensure that you are ready when you sit for that exam. Now, we know the exam is not cheap, right? It is very expensive, but think of it as an investment in yourself. Us here at Dr. Sellars Educate have been exactly where you are. We all, including me and the advisory board that gives me feedback and guides me throughout the program and services that we offer, have been exactly where you are. I have put off the CNE for 5 years. So we are speaking from firsthand experience when we talk about the journey. I'm looking at reflection first. We want to share that we have received notification, and we want to hear from all of you all. Okay, so this is a part of the reflection. As you move towards that journey, just realizing that with the experience, the resources, and the support, you have everything you need to be successful on the exam, just like this specific educator. She shared with us 4 days ago that on our website, so you can see all of our reviews on our Google business site. That's Dr. Sellars Educate business site. If you type that in, you'll see our page. But we like hearing from you. We want to hear whether or not you felt prepared. We maintain the confidentiality of the NLN exam, so we don't go into questions about the content. We simply want to know, did we help you be successful? And also remember that we're here to support you until you are successful, and it's a no judgment zone. But for this specific educator, we wanted to share this because it was really special. It resonates with many of us. This specific educator says she had been putting off taking the CNE exam, mainly because she didn't feel like she had the time to really prepare. So she attended our How to Prepare workshop. She purchased the 6th edition of Billings and Halstead Teaching and Nursing, and she already had Dr. Caputi's review book 2nd edition. She followed the recommended study schedule, and she reviewed the competency snapshots on YouTube, just like you are now. So if you haven't subscribed to this channel, go ahead and click that button so you can be notified every single time there's a new episode. We usually release one every week. And she passed, right? So we were super excited to hear from this nurse educator that was successful. As we look at content in Billings and Halstead related to reflection, you're going to be focusing on chapter 24, page 457. We really like table 24.1, and I'm going to turn there with you. You're going to see this table is listed as an overview of evaluation strategy. So when we think about reflection, we often think about it being an assignment, whether it's with the clinical experience, sim experience, or it could be what I call a 1-minute paper. I really enjoyed doing reflections and used it at the front end of my classes when I was teaching in person, or the back end. And I still use it today, even though I predominantly teach online. So just taking time to reflect on where you are on your nursing education journey to ensure that you are closing your gaps. We're going to take a look at our success model, but the model that we developed based on our discussions with nurse educators who have been on the same journey just as you are towards certification. It really is consistent that with 3+ years of experience, it does increase your likelihood to be successful on the exam, specifically the CNE. Now, for the novice, as you all know, if you're interested in that exam, it was designed specifically for those novice nurse educators with less than 3 years of experience. Okay, so if that's you, we encourage you to check out the NLN website. We're not endorsed by NLN. we simply follow their recommendations to support nurse educators on their journey towards success. So again, back to table 24.1, what we really like about this table is it shares the domain of the specific evaluation strategy, the applications. Remember that the CNE exams are all around application, right? We want to be able to validate to NLN that we indeed are a high functioning nurse educator. We know that when we look at the certification from NLN, it is a mark of distinction for us as nursing faculty to achieve certification. And then you see also advantages, disadvantages, and then any issues associated with that evaluation strategy. On the table, you see reflection is listed as a high-level cognitive, affective domain, formative, and summative. So these are all 4 different types of learning domains and 4 different ways that we can use reflection. And then the applications talks about self-assessment, which we're going to talk about as part of our review today. And that it's appropriate for assessing the higher level cognitive skills. And then if you turn over to page 460 and 461, that's where you'll see a deeper dive and looking at the content as it relates to reflection. Specifically, this chapter talks about the use of reflection as a learning activity really does encourage our students to fully consider a question, an experience, or process regarding their thoughts. So for example, a reflection may focus on preclinical experiences, exploration of values, or post-clinical or post-sim reactions to an experience. Or it could be a self-assessment of a component of professional development. I really like that they have included that last part of that sentence because we don't need to restrict reflection only to the clinical or the simulation experiences, right? We want to, as much as we have an opportunity within our curriculum, to bridge the gap between theory and clinical. Dr. Patricia Benner talks about that in her book, Educating Nurses, and she also reflected on that and presented her work at the ATI Summit earlier this year. You all have probably heard me talk about that if you have tuned in to any of our previous episodes. So reflection is really important. And next, we want to do a self-assessment. Okay, so when we talk about different components of reflection, this is one area. We want to take the time to assess where we are as it relates to the CNE competencies and identify where our gaps are. You can do something as simple as printing out that detailed test blueprint and putting an asterisk or highlighting any of those, what we call sub-content areas underneath each of the 8 competencies. And then you want to focus on those, right? That's where you start. Those areas where you have a large gap area, and then the ones that you feel pretty confident about. Perhaps you're going to use a scale of 1 to 3, 1 being large gap area, and 3 being a point where you feel like you have a lot of knowledge and expertise related to that specific sub-content areas. But you want to take some time to do a self-assessment. All right, so let's pause in our content and take a look at this practice question and let's see what you think. So we have a situation where several of our students are struggling with understanding the care of the CHF patient. If you haven't heard before, cardiology is my specialty. When I was in nursing practice, direct patient care, it was my love. Part of it is because I have a strong family history of cardiac, so I had an affinity and a personal connection to understanding the cardiac system early on in my nursing career. So which strategy should the instructor use to best facilitate their learning needs? You can pause right here and jot down your answer. And if you chose B, unfolding case studies, you are correct. What you want to think about when you look at any of these practice questions that we share, and these are they are developed from us or by us. So they are firsthand developed practice questions, but they are exactly that. We know from previous episodes, if you haven't heard it before, many of the questions are going to be a 3-part question on the CNE exam. So you may have a statement, which may be a fact, it's listed here. And then you may also have a scenario as the second part. And then that third part is going to ask you to either apply your knowledge or just test your knowledge related to the specific concept that is described. So unfolding case studies is going to be the best to, again, facilitate learner development. 1-minute paper, that's a great reflection activity. But we're talking about the best way to facilitate the individual learner's needs. Algorithms, probably not the best answer, right? What if, then what example is a great opportunity for students to learn, but it really is not going to be the best answer to facilitate our students' learning needs. So algorithms, think about ACLS. You know, what if a patient stops breathing? Then what actions would you take? That's what we mean by algorithms, just to level set for everybody. And then flashcards, that's a great asynchronous activity where there's not really facilitation of learning. But again, it's all about looking at what the question is actually asking you. So that's why unfolding case studies would be the best option. All right, so to wrap up our time together, integration of learning, really taking the time to assign students the assignment of a reflection. We need to make sure we explain the instructions of the assignment. Okay, so if our goal is to integrate learning, which it should be when we ask students to complete a reflection, we want to incorporate directions or instructions that will allow students to complete the assignment independently, the reflection assignment independently, and for us to validate that learning has actually happened. How do we do that? Perhaps we're asking in a post-clinical conference reflection for the student to describe some learning opportunities for them that they identified as part of their clinical experience for that day. Okay, so that's one way. And based on that, we can see if students were able to kind of process the care of the heart failure patient, for example, and perhaps what they did wrong and what they're going to do differently next time. So it's going to pull in concepts that they should have learned in the didactic setting and been able to apply, but maybe they didn't. Maybe they missed the mark, and it's going to give them a chance to kind of see that for themselves and explore that feeling in their knowledge. And we can come alongside students in that next clinical experience to really close those gaps so they can do a better job and align their nursing practice with what the evidence says it should be when it comes to caring for that heart failure patient. And then our third concept associated with reflection is going to be assessing those higher level cognitive skills. So thinking about the student doing a proper cardiac assessment, think about them understanding the pathophysiological effects of Lasix or furosemide on the body of a heart failure patient, thinking about what a decreased pulse in their pedal pulses would indicate for that patient that nursing student is taking care of that has a diagnosis of heart failure. So again, we want to think about what the reflection activity, what the goals are, and we want to really make them make sense for us. So as you're closing your gaps, you too can follow exactly what we just talked about, you know, thinking about your knowledge of those higher level cognitive skills in Bloom's taxonomy. We know that with the taxonomy for cognitive learning, it starts, the lowest level is remembering. So we want our students to memorize some information, but we want them to quickly scale up the taxonomy to where they are analyzing and ultimately creating, which is the highest level on Bloom's taxonomy for cognitive learning. The steps are very simple to follow, right? It's just a matter of you having the time, having the resources, having the support you need to be successful. So create that vision for yourself. You know, start today. Today is day one. You get to start all over again and looking at your plan. What is your goal? Are you going to be able to commit to 8 hours a week? Or is it going to be 12 hours a week? And then execute on that plan. We're going to dig back into our study workbook and the study plan in our next episode, but we want you to take action so you can be successful. It is possible for you to be successful. We have talked about several different educators that we have supported along the way, but you got to review the content, okay? And many of us struggle being able to do that independently. So we offer monthly review sessions. Those are all via Zoom right now, but we're also offering an in-person event for review, and they all also offer contact hours for C&E. For C&E-CL, we're working on that. That's to come as soon as we get approval to offer contact hours. We'll definitely let you all know. But we heard from this specific colleague on March 18th. She says, thank you, thank you, thank you. I learned so much, not only about content, but about how to apply content largely through your role modeling. That's what we're all about here at Dr. Sellars Educate. We don't want to just talk the talk. We want to walk the walk. We want to demonstrate some of these best practice standards that are described in the resources that we use in Billings and Halstead, in Dr. Caputi, and of course, based on the NLN guidelines for each of the competencies that's aligned with the exams. So she also said that she has already that she would recommend our course to everyone. And I have to say, word of mouth is definitely the best compliment that we can receive. I already have to the director of our education track. Hope you have an awesome weekend. So we like to hear from you. We like to hear what worked well, what didn't work well. That's the only way we can get better. This is what we call our 7-week study plan. We do recommend somewhere between a 4 and 6 week plan. Because it does include, the focus, the content focus for that 4 to 6 weeks. But you see here an extra week that we've allotted for you to purchase your resources. So if you already have them, the clock is ticking and we want to support you every step of the way. Are you ready? Are you ready to be successful? We know that without a doubt, as I mentioned, we have here what we call our success framework. So you want to do that self-assessment. You want to work on closing those gaps, and we're here to support you. It's still reported in 2020 that only 69% of nurse educators were successful on the CNE exam, and 74% were successful on the CNE-CL. We're seeing about a 95 to 97% pass rate for the CNE-CL. We have 100% pass rate for the CNE novice, and somewhere around a 90 to 94% pass rate for the CNE. We don't make any guarantees on whether or not you'll be successful, but here's what we do guarantee: that we will support you every step of the way, okay? And that, again, this is a no judgment zone. So this went a little long, but hopefully this was really helpful information for you, and this is how you can contact us. Make sure you check out details in the description. We're going to list out the information about how to access our YouTube directory. We have more than 60 episodes right now, and we are all about you being able to focus your time and to make it as productive as it can be, because we know you're super busy. But you're also going to see, again, the resources with Billings and Halstead, 6th edition. Yes, we want you to get the most current edition. Okay, you can even rent it on Amazon. Amazon has everything. So those are going to be your primary resources: Dr. Caputi's 2nd edition review book, Billings and Halstead Teaching and Nursing 6th edition, and then the NLN Candidate Handbook. We also offer you a study workbook for CNE and CNE-CL. That information is on our website. All right, we'll reach out if you have questions, and we'll see you next time. Have a great one, everybody.